Assalamualaikum warahmatullahi wabarakatuh and a very good morning I bid to Miss Faika binti Zakaria and all my beloved friends. Let me introduce my name first. I am Aida Izzah binti Hashim. I am from HS2426A and also my partner Raja Anis Nasuha binti Raja Muhammad Roslan. Both of us will be presenting on MRI protocols of hips regarding on the subject MRD 568 MRI techniques and protocols. This is the content that we include in our slide to be as a guideline to all of you in searching the information in our slide. So we will go to the Number 1, which is anatomy of hip. In MRI, first of all, we must know the anatomy first. So, this is the anatomy of hip and highlighted in the yellow color. As we can see, the acetabulolabrum. Acetabulolabrum is a soft tissue structure that lines the socket part of the hip joint. It is triangular in cross-section, thinner anteriorly and thicker posteriorly. It has low signal intensity on all pulse sequences due to the fibrocartilage composition. So, as we can see here, this is the acetabulolabrum. This is the coronal section of MRI hip. And many changes and pathologies might seen in the femoral head, femoral neck, and also the muscle. What are the indications for MRI hip? So, we include 3 indications in this slide, which is avascular necrosis, acetabulolabral tear, and also transient osteoporosis of the hip. Okay, avascular necrosis, or also known as osteonecrosis, is the death of bone tissue because of lack of blood supply. Acetabulolabral tear can cause pain or a sensation of catching or popping in the joint. Okay, and the last one, transient osteoporosis of the hip, is a condition that causes temporary bone loss in the upper portion of the femur. Okay, let's see the patient preparations before, during, and after. Before examination, a satisfactory written consent form must be taken. Next, check BUN, creatinine level, and eGFR. For patients with low eGFR below 30, the patient cannot undergo the MRI examination with contrast agent. Patient with tattoos, place wet cloth or ice pack at that site as the thermal insulation and to prevent any burns from the longer examination. Instruct patient to change into hospital gown and explain to the patient to remove all metallic objects including undergarment. During the procedure, explain the procedure to the patient. Provide earplug or earphones with music to avoid hearing impairment and also for patient comfort. Also provide emergency bell to the patient so that they can use in any emergency. Instruct the patient to keep still and monitor patient condition. After the examination, bring the patient out from MR scanner slowly. This is because we have to give patient time to adapt with the situation after a long examination of MRI. remove coils, headphones, and buzzer or emergency bell from patient, tells them that the procedure is done and she or he may change into their clothes. For patient safety and ethical consideration, for patients with tattoos, care to be taken by placing thermal insulation such as wet cloth or ice pack. Next, patients with a hip prosthesis may experience warmth during examination. Thus, they have to be warned of all of this effect, and emergency bell has to be provided and used in case of any discomfort. All patients should be monitored, includes patients who are not sedated or hearing impaired and pediatric patients. And gadolinium enhancement is best avoided when examining a pregnant patient. For contrast agent, intra-articular contrast administration, which is a dilute technique, is used to assess labral pathology. A 1:100 dilution of gadolinium in normal saline is injected into the joint with a small amount of radio-opaque contrast material. The high contrast gadolinium compared with the low signal labrum makes identification of tears easier. Recommended for a fat suppression with T1 weighted images after intra-articular contrast injection to make the gadolinium more conspicuous. Okay, for consent form, this is a sample from Hospital Sultanah Bahia, Al-Dusta, which is a checklist for MRI examination, includes MRI consent form. So, as we can see here, the upper part of the checklist and MRI consent. So, we can see there is a patient's ID and IC number. This is important to verification of patient and also patient's weight. Patient's weight is important when we want to insert the contrast material. And then ask patient if any previous surgery, any experience of MRI examination, pregnancy, asthma, and allergy. A checklist of any metallic object or implants in patient's body. Here. And the bottom one is the MRI consent that will be signed by the patient or their guardian. For image appearance of avascular necrosis, as we can compare from the normal coronal T1 weighted, there is no any dark appearance, but in the coronal T1 weighted with avascular necrosis, the image showing small foci of abnormal subchondral signal intensity with low signal borders, which is appear darker, are present in both femoral heads. Okay, for image appearance in acetabular labyrinthe, as we can see in normal coronal T1 weighted fat set arthrogram, the image show a low signal intensity, but in image with acetabular labyrinthe, there is high signal intensity here. So, in MRI arthrography, labral tears are confirmed by contrast material extending into the tear defect. In transient osteoporosis of hip, this is the normal coronal T1 weighted. Okay, this is the femoral hip and femoral neck. For image of coronal fat suppressed T2 weighted image shows high signal which is hyper intense in the femoral head and also femoral neck that represent bone marrow edema from hyperemia. The rest will be further explained by my partner Raja Anis Nasuha binti Raja Muhammad Roslan.
Okay, thank you Aida and Izzah for your explanation. Assalamualaikum warahmatullahi wabarakatuh. I am Raja Anis Nasuha binti Raja Muhammad Roslan from HS 24268. So now I will proceed with the equipment preparation for MRI hip examination. Okay, the equipment used are earplugs or headphones, immobilization pads and straps, tape, body coil or large flex coils. There are two types of coil being used for MRI hip examination, which is the first one is the body coil. Body coil, we can use body coil if we want to examine both sides of hips. It is because for body coil, we can receive signal from a large FOV of bilateral hips. Whereas for large flex coil, which is one type of surface coil, is being used if we want to examine only one side of hips. One side of hip, which is the symptomatic hip. Large flex coil is a collection of multiple surface coils into a larger array, and it provides small coverage but greater SNR for tissue. Greater SNR is achieved because it only receives noise from a small region of the anatomy, which is covered only the hip region. Okay, this is the way we apply body coil, and this is the way we apply large flex coil. Okay, next is patient positioning. First, position the patient supine on the couch, feet first with their legs straight, and then internally rotate the feet 15 degrees and gently immobilize with tape if necessary. It is similar with in this image. And then give a pillow for extra comfort and headphone to prevent hearing impairment from the loud gradient noise from MRI machine. Next, place body coil over the pelvis, which cover the region from iliac crest to mid-thigh, and securely tighten the body coil with straps. And then make sure the longitudinal alignment light lies in the midline, while the horizontal alignment light passes through the level of femoral heads, the right and left femoral heads. Okay, there are 7 basic protocols for MRI hip, including the localizer. Okay, localizer is done to localize and plan the sequence. It consists of 3 planes, which are the coronal, axial, and sagittal of T1 weighted low resolution scans. Okay, why we need to use the T1 weighted? Because T1 weighted is very good to demonstrate and visualize the outline of the anatomy instead of T2 and PD weighted. So it will be useful for the localizer. Okay, next is coronal T1 TSE, including both hips. It is to assess fractures of the acetabulum or proximal femur and bone marrow infiltration. Okay, first, plan the coronal slice on the axial plane, angle the positioning block parallel to the right and left femoral head. And appropriate angle must be given in sagittal plane so that it is parallel to the femur, and the slice must cover hip joints from ischial tuberosities to the line of pubic symphysis. Okay, the image appearance will be look like this. Okay, as it is a T1 sequence, so the bone that is filled with fatty marrow will appear bright, which is hyper intense, while the structure that filled with fluid will appear dark, hypo intense. Okay, the scanning parameter are TR 400 to 600, TE 15 to 25, thickness 6 mm, gap 10%, flip 140, face right to left, FOV 35 to 38 cm, and matrix 384 times 320, and NEX of 2. Okay, next is coronal T2 stir, including both hips. It is to detect bone marrow edema and injuries involving tendon or muscle. The planning are similar with the coronal T1 TSE. The only difference are in the image appearance and the scanning parameter. Okay, as it is stir, so the structure that filled with fat will appear hypo-intense, dark, because it suppresses all signal from fat to enhance the fluid detection. So that's why a structure that filled with fluid will appear hyper-intense, bright. The scanning parameter are TR 4000 to 5000, TE 110, thickness 6 mm, gap 10%, flip 130, face right to left, FOV 35 to 38 cm, and matrix 320 times 320, and EX of 2, TI 130. Okay, next is axial T1 TSE, including both hips. It is to evaluate both hips simultaneously, particularly the acetabulum. Okay. Plan the axial slice on the coronal plane. Angle the positioning block parallel to the right and left femoral head. And appropriate angle must be given in sagittal plane so that it is perpendicular to the femur. And the slice must cover hip joints from anterior superior iliac spine up to the lesser trochanter. So the scanning parameter are TR 400 to 600, TE 15 to 25, thickness 6 mm, gap 10%, flip 140, face anterior to posterior, FOV 34 to 36 cm, and matrix 320 times 320, and EX of 2. Okay, next is axial T2 stir, including both hips, to detect bone marrow and soft tissue edema. The planning also the same with the axial T1 TSE, and the only difference are in the image appearance and the scanning parameter. The scanning parameter are TR 4000 to 5000, TE 110, thickness 6 mm, gap 10%, flip 130, face anterior to posterior, FOV and matrix 34 to 36 cm, 320 times 320, and the X2 and TI 130. Okay, next is sagittal T2 TSE affected site. It is to evaluate the hip joint cartilage and acetabular roof, investigating abnormalities of the proximal hamstring muscles and tendons, and assessing anterosuperior labral tear. Okay, first plan the sagittal slice on the coronal plane, angle the positioning block parallel to the femur, and appropriate angle must be given in axial plane so that it is perpendicular to the femoral head, and the slice must cover hip joint from outer cortex of greater trochanter to the inner portion of the acetabulum. And the scanning parameter are TR 3000 to 4000, TE 100 to 120, thickness 3 mm, gap 10%, flip 130 to 150, face anterior to posterior, FOV 25 to 28 cm, and matrix 320 times 320, and EX 2. Okay, the last one is axial oblique PD facet affected site. It is to evaluate the femoral head neck junction in FAI syndrome and best evaluate the acetabular labrum and the articular cartilage. Okay, plan the axial oblique slices on the coronal plane, angle the positioning block parallel to the femoral neck. An appropriate angle must be given in axial plane so that it is perpendicular to the femoral heads, and slices must cover hip joint from 2 slices above the superior border of acetabulum and 2 slices below inferior border of the acetabulum. The scanning parameter are TR 3000 to 4000, PE 15 to 20, thickness 3 mm, gap 10%, flip 150, face anterior to posterior, FOV and matrix 20 to 25 cm and 256 times 256 NEX 2. Okay, there are 2 additional protocols for MRI hip. The first one is the coronal FSCT to with or without tissue suppression both hips. The purpose, it is an additional sequence to the examination of unilateral hip. It is especially to rule out pathology of avascular necrosis, AVN, of the asymptomatic hip. So the scanning parameter are as follows. And this is the example of image of coronal T2 with fat saturation, with fat suppression. Okay, for example, the symptomatic hip is the right side of the hip. So we can use this sequence to compare symptomatic hip, the right symptomatic hip with the left asymptomatic hips to detect if there is any presence of avascular necrosis on the left side of hip. So next is SE or FSC or incoherent spoil GRET1 plus contrast. The purpose is to visualize labral tears and chondral defects after intra-articular injection of contrast. Okay, what means by intra-articular injection of contrast? It means by the contrast media is being administered directly into the hip joint. Okay, this sequence are being done after administration of a very dilute solution of gadolinium contrast agent in saline in ratio of 1 to 100 into the joint capsule. Okay, this sequence are being done on 3 planes, which is the coronal T1, axial oblique T1, sagittal T1 with fat suppression. Okay, the scanning parameter are as follows. These are the image appearance of for this sequence. This is coronal T1 fat set, this is axial oblique T1 fat set, and this is sagittal T1 fat set. As you can see in these 3 images, there are areas of hyperintensity, which is bright, that indicate the presence of gadolinium contrast agent. Okay, next I will proceed with the artifact. One common artifact in the MRI hip is the magnetic susceptibility artifact. The image will appear, as you can see in this image, the image will appear distorted with large signal voids in this area. It happens due to the presence of hip prosthesis or pins, and we can reduce or prevent this artifact by selecting spin echo or fast spin echo sequence instead of gradient recall echo GRE sequence. It is because GRE sequence cannot compensate for the magnetic inhomogeneities. Or we can orienting the long axis of the implant along the frequency encoding gradient. Next is ghosting artifact. It appears as replication of moving anatomy, which is it appears as replication of moving anatomy across the image in the phase encoding axis, which is, as you can see in this image, this is the artifact. It is happened due to flow of blood within femoral and iliac vessels. So this is the replication of the blood. And the remedy are place a special pre-saturation pulse superior and inferior to the hip to saturate the inflowing spin. Or we can use motion reduction techniques such as propeller. As a conclusion, two most common indications for MRI hip are avascular necrosis and labral tear. Different FOV size and different type of coils are being used for bilateral hips and unilateral hip. Large FOV size and body coil are being used for bilateral hips, while for unilateral hip, smaller FOV size and large flex coil are being used. And contrast media is not routinely used unless for specific hip disorders such as the labral tear. Okay, this is our reference. Thank you.